back to the past couple of years, there was a big, particularly during the Obama administration, a big scandal with wait times. Give us a sense of just how widespread that was and how legit the response was, or how measured the response was to the actual problem.
Right. So basically what happened was, very stupidly in my view, and this is a big problem with VA Washington National Management, right, which you have to distinguish from clinical care at the front lines. Ever since Bush came in, they've really tried to roll back by cuts in funding and by centralizing and micromanaging the front lines. They've tried to cut back a lot of advances that were made in the 90s and early 2000s in the VA to make it the best healthcare system, in my view, still with all its problems in the country. Basically what happened was they instituted a very flawed metric throughout the system of having patients guaranteed that they wouldn't have to wait for more than 14 days for a first appointment with a physician or provider, could be a nurse practitioner, et cetera. And that is a very unrealistic metric, and there were people in places like Phoenix who outright lied about whether they were matching the metric. Now, you also have to understand, and the press has never reported this accurately, that the places where the wait time problems were the most severe, like Phoenix, were places that had this huge sudden influx of veterans because they were either retiring there, or Phoenix, for example, has 25,000 veterans going there every winter for 3 months, 3-4 months. They descend on this healthcare system. It's very hard to staff a system if you're trying to accommodate 25,000 more patients and you're saying to a nurse or doctor, oh, by the way, we can feed you for 3 months and then you're out of here,
Right.
So they made really bad decisions, and they were, they deserved to be fired, et cetera. But this was not a system-wide problem, but it was jumped on by the right-wing media, particularly the Koch brothers, who have funded a anti-VA phony veteran service group called the Concerned Veterans for America. And basically, they've been flogging these negative stories and paying people to exaggerate and sensationalize these negative stories for the past 4 years. And the media, in my view, is really culpable because the media doesn't provide a balanced view of the VA. The media should be covering the problems, but it never covers the successes. And that's really tragic.
Yeah, that's fascinating about Phoenix. It had never occurred to me, and I certainly never saw it reported. But yes, I would imagine that's a huge problem when you have basically a seasonal explosion of a population. You still got to support that hospital for the entire 12 months. It's not easy to just sort of ramp up for 3 months and then tell everybody see you the next snowbird season, essentially.
Yeah, I mean, would you take a job? You're a reporter. If some newspaper said, come to us and give up your job and give up your home for 3 months, and then you're on your own. I mean, it's ridiculous, and it was never reported. And then what was reported were way exaggerations. They said that many people died. It's clear that 6 people died, but they died while they were waiting for an appointment, and it's not clear that they died because they were waiting for an appointment. In other words, you can have cancer and have an appointment with your oncologist and die.
Right.
While you're waiting. That doesn't mean you died because you were waiting. But the media has really been terrible on this, and story after story. The latest one was in the Times the other day about problems in a rural VA. That has a lot to do with the fact that nobody, doctors, nurses, PTs, nobody wants to work in rural America. How do you you staff a hospital in rural America when nobody wants to come there. And here's another thing, Sam, that people don't know. The VA is legally prevented from providing market rate salaries to its staff. So if you want to work in the VA in San Francisco, you are guaranteed to be paid, $30,000, $40,000, $100,000 less than you could make working in the private sector. And Congress could fix that and won't.
And of course, the housing. If you're living in San Francisco, nobody's giving you a break because you're statutorily not allowed to make as much as your fellow I guess your colleagues in. And so, all right. So, lastly, let me just ask you this in closing, because it at the end of the day, it seems like a very classic case of a privatization, and whether it's the same dynamic, whether you're talking about like trying to privatize Social Security, trying to privatize education, because there's a big pool of money there, and private capitalists want that money, period, end of story. And their job number one is to create profit rather than results that necessarily services. And so, all right, so how much of these challenges were they there under the Obama administration, or I guess, and how more serious are they today? And go ahead.
No, go ahead.
Well, I just wanted to put this also in the context of like these politics seem to me to be greater than even the VA and the VHA. I mean, there's totally. It fits into a larger rubric.
The reason why the Koch brothers have spent millions and millions and millions of dollars fighting the VA is because they know it's a successful example of single-payer health care, and they want to defeat government. It's a successful example of government, and they're doing that. And you are absolutely right. I mean, fighting privatization in the VA, which I think every single one of us should do, and I think you don't have to be a veteran to be for the VA. I'm not a veteran. Nobody in my family works for the VA. Nobody in my Koch family is a veteran. But I have a bumper sticker on my car that says, "I love my VA" and "Save our VA." These are bumper stickers that are put out by a group called Fighting for Veterans Healthcare, which I urge all your listeners to look up on the website. And I have it on my car because the VA is mine. It's a national treasure. We've, as citizens, invested for 70 years in the VA. It's a great healthcare system. It serves us all. And we should all be fighting this privatization push because it doesn't serve the nation, and it's going to take away research, teaching, clinical models of clinical care. I mean, I didn't mention it, but the VA is one of the only healthcare systems in the country that actually delivers team-based care, where clinicians actually talk to each other face to face. And I think this privatization, the people in Congress who are for privatization know privatization is a dirty word among veterans. And so they're constantly saying that these bills that would outsource care to the private sector aren't privatization. They are privatization.
The very definition of it. Well,
they are the very definition of privatization, and we should, be calling Congress and saying, we don't want you to privatize the VA. You don't have to be a veteran to make that call.
Suzanne Gordon, the book is The Battle for Veterans Healthcare: Dispatches from the Front Lines of Policy Making and Patient Care. Thank you so much for your time today. I really appreciate it.
Okay, thanks. And if people want to see my website, it's www.suzannegordon.com.
We will put a link both to that site and the book at majority.fm. Thank you so much, Suzanne.
Thank you so much, Sam.
Bye-bye. Hi, folks. Sam Seder here. We still need your help on our Patreon page. YouTube ads have come back, but not nearly as much as we had before. So if you can help us out, any little bit helps. Head over to our Patreon page right at this URL, and you'll help us keep helping you by making videos